Brockville General Hospital has been caring for our community since 1885. Much has changed in the world over those 139 years, but one constant is that our community could always depend on Brockville General to be there when needed. We've done that by overcoming every challenge with determination and innovation. With that same spirit, today we are modernizing and expanding our hospital and services to prepare for the future, ensuring we continue to be right here with you. Working with our leadership, the hospital's volunteer board of directors is committed to achieving excellence together and providing a comprehensive range of services and quality compassionate care in Leeds and Grenville. Brockville General is the largest employer in our region. Our mission is to collaborate with our patients, their families, and our partners to deliver the best healthcare experience. It is also critical to the economic health and well-being of the area we serve. This wasn't an easy year for Brockville General or for healthcare systems in Ontario, across Canada, and around the world. Emerging from the COVID-19 pandemic, we faced new challenges like an unprecedented demand for service, maintaining staffing levels, and financial pressures. I'm very proud of the Brockville General team for meeting these issues head-on by implementing innovative solutions while showing leadership through our advocacy locally and at the provincial level. I'd like to take this opportunity to give a heartfelt thanks to our leaders, staff, physicians, and volunteers for everything they do to provide outstanding care.
Brockville General Hospital is all about people. Our patients and their families, our dedicated physicians, healthcare professionals, staff, and leaders, our volunteers and our donors, and our many invaluable partners. As we reflect on an incredibly busy, challenging, but ultimately rewarding year, it's important to acknowledge and thank each of you. The theme in this year's report is how, in an ever-evolving healthcare landscape, Brockville General is not waiting to react. We are leading, we are planning, and reacting now to be ready for tomorrow. We're embracing our responsibility to be an advocate for the healthcare system. In our presentation to the Legislative Assembly Standing Committee on Economic Affairs in January, we had three asks of the government: investments to stabilize hospital operations, further expansion of primary care so everyone in Ontario has a family practitioner, approval of our capital planning grant to begin the next phase of our hospital expansion. As we plan for tomorrow, over the past year we have made significant investments to improve and expand our services now. This includes a new regional pediatric surgical program, a new mammography scanner and suite, an expanded learning lab to support frontline staff and offer courses to the community, and pioneering access to MRI services. None of this would have been possible without the support of our incredible partners at the Brockville and District Hospital Foundation and the Brockville General Hospital Volunteer Association. We also want to sincerely thank our local MPP Steve Clark for being such a strong advocate for us and the Ontario government for its support. Now we'd like to share some of our many highlights from the past year.
At Brockville General, we pride ourselves on providing a safe, trusted, and quality healthcare experience. We do this by growing our programs and improving access to the services our community needs. This includes enhancing our existing spaces to continue to provide great care. In October 2023, we opened our newly renovated outpatient clinics and cancer care unit. The renovated unit provides more space for our patients and healthcare workers. The new location has plenty of natural sunlight, which makes the space much brighter. We also replaced our mammography unit this year. The new unit has enhanced capabilities that we did not have with the older system. With the upcoming change to allow people 40 and older to self-refer for a mammogram, this new system was vital. We continue to update and revitalize our emergency department. In summer 2023, we installed new flooring and lighting in the waiting room. This summer, we will complete the construction of a 3-room emergency mental health assessment and care room, fondly named EMAC. These specialty designed rooms provide individuals who are experiencing a mental health crisis a designated safe space to receive care. We are also making investments in our surgical services department. new overhead lights in our operating rooms, and a new system that cleans and sterilizes our medical equipment ensures our healthcare workers have modern tools right at their fingertips. We also believe in investing in our people. With many new health professionals entering the medical field, our new learning lab is our way to help them continue their education throughout their career. The Learning Lab is open 24/7, providing our staff and physicians a dedicated space to practice their skills or even learn some new ones. Together, we are modernizing to provide the world-class care our community deserves.
Physicians play a critical role in a patient's healthcare journey, but we don't do it alone. We work collaboratively with healthcare professionals from across our hospital as well as across the region. We do so because we know that by working together, we can provide quality and timely care for our patients. There's no better example of collaborating for our patients' benefit than our partnership with CHEO and Kids Come First Health Team. With this innovative model, CHEO serves as the hub, collaborating with partners like our hospital to provide specialized care to children in their home communities. Since October 2023, Brockville General has been able to offer ear, nose, and throat surgeries for children aged 6 and up, and orthopedic surgeries for children aged 12 and up. It's streamlined, it's efficient, and most importantly, it gets kids the care they need faster. Getting our patients the care they need faster was one of the driving forces behind the introduction of our new MRI service. MRIs are the gold standard for diagnostic tests and is an important step as we grow to meet the needs of our community. To ensure we were scanning patients as soon as possible, we innovated to build, install, and operationalize our MRI suite in a quick turnaround time. In partnership with SDI Canada, our MRI suite is a custom medical-grade modular building solution. The suite was built off-site and then installed at the hospital, limiting disruption to services. This was a first for an Ontario hospital, and now Brockville General is being used as the blueprint for future suite installations at other hospitals. With our MRI now scanning patients, physicians in Brockville and across the region have quicker access to this important diagnostic tool. All these investments allow us as physicians to use our full skill set while being part of a dynamic team of professionals who value patient-centered care.
We believe in inspiring and empowering our teams to be the best at what they do. We do this by continually recognizing the dedicated work they do every day. Each year, we hold numerous recognition events, including free meals, staff wellness centers, peer support initiatives, and long service awards. Staff also recognize each other with our peer-led team and Team Member of the Year awards. Open and honest communication is at the heart of everything we do. We keep our teams informed regularly through bi-weekly newsletters and open staff forums. We encourage our staff and physicians to reach out to hospital leadership to let us know what we are doing well and how we can improve. Our 2024 staff engagement survey shows that 85% of our staff are satisfied with their job, and 90% of staff feel their job makes good use of their skills. Our teams take pride in the work they do, and it shows. Our environmental services team keeps our hospital clean, with our hospital scoring a 98% pass rate for cleanliness. Patients also score our nutritional services quite high, with a 96% patient satisfaction rate with our patient meals. Brockville is the 4th oldest community in the province, meaning more and more people need our services, which means our healthcare workers face more pressures to keep up with the demand. This is why we are aggressively recruiting new healthcare workers to our hospital. Last year, in partnership with the City of Brockville and the Employment and Education Centre, we launched our healthcare worker recruitment campaign, Imagine Brockville Life. This campaign highlights our diverse workforce and the lifestyle that Brockville and area offers. Through this campaign, we're inviting healthcare professionals from across the world to imagine their life in our riverfront community while working at a modern, expanding hospital. We're also making it easier than ever for prospective hires to join our hospital. Earlier this year, we introduced our new job application portal. The modernized portal streamlines our entire application process. It ensures we can attract qualified candidates and get them working at our hospital faster. By investing in our people, we are retaining and growing our highly skilled workforce to ensure when our community needs care that we are there.
At Brockville General, we are embracing technology to improve and modernize our hospital to meet the needs of our community and to help our most valued resource, our staff. This past February, we launched 2 very innovative systems. One, in our diagnostic imaging department, we transitioned to a new picture archiving and communication system to give the staff access to the most up-to-date visualization and reporting tools. And we are the second in the province to do so. This new PACS system is revolutionary. We have also launched the MyLearn in February. The MyLearn is a new centralized learning management system where staff can complete all education and training and stay up to date all in one convenient location. This summer, our new workforce management system, UKG, will be starting at the end of August. The platform makes it easier for staff to view and manage their individual schedules and to help streamline the workload in our scheduling department. This winter, we are launching Lumio, a single electronic regional health information system that will connect us to our 5 partner hospitals in the Southeast Ontario region. Lumio will replace paper-based records and provide a single source of patient health information that will help healthcare workers coordinate and deliver high quality and safe care throughout the region. These investments in technology allow the staff to do what they do best, provide world-class care to our patients. Careful planning and the wise use of resources has enabled us to make these investments while maintaining our fiscal responsibility. As a result, Brockville General presents its 7th consecutive balanced operating result.
At Brockville General, achieving excellence together means collaborating with patients and their families to deliver the best healthcare experience. We focus on patient and family-centered care, and this year redesigned our patient and family guide, as well as our program-specific patient materials. This was done in partnership with our Patient and Family Advisory Council, as well as patient advisors in each program area. Our designated care partner program has been enhanced, recognizing their integral role in supporting a patient's emotional, cognitive, and physical well-being. Brockville General's pursuit of healthcare excellence is guided by continuous quality improvement and a rigorous accreditation program. Accreditation Canada conducted an on-site survey in December, and we're proud to be compliant in all high-risk areas they reviewed. Our comprehensive quality improvement plan sets ambitious targets to ensure the hospital's priorities in access to care, patient experience, staff well-being, and safety are embedded in everything we do. The plan also underscores our commitment to build a culture of equity, diversity, and inclusion. A dedicated committee is leading this work, and this year we created a multi-faith quiet room for staff, patients, and families. In addition, the Canadian Institute for Health Information tracks our clinical performance across several indicators. Brockville General consistently ranks among the best performing hospitals, including emergency department wait times and hospital standardized mortality ratios. We're using data to inform everything we do and implementing evidence-based practices to improve access to care. This ensures the healthcare patients receive meet the highest standards of safety and effectiveness.
At Brockville General, we are well positioned to continue to be the center of healthcare excellence in Leeds-Grenville. Thank you to the Brockville and District Hospital Foundation for raising $12.5 million as part of the Your Health, Your Hospital MRI and Equipment campaign. Without their support and the support of our community, our MRI, emergency mental health assessment and care rooms, and our new mammography upgrades would not have been possible.
I'd like to thank Dr. Barry Guppy, our outgoing Chief of Staff, for his dedicated service to the hospital. We wish him all the best in his retirement. Also, thank you to Dr. Michael Fuoco for stepping up as our Acting Chief of Staff, and to Dr. Karim Samani, who serves as our President of Medical Staff Association. I'd also like to thank Nick Vlacholias. Nick is incredibly dedicated as he shows through his work both inside and outside the hospital. He keeps our community informed through his weekly radio interviews and provides such leadership to the staff and physicians here at the hospital.
By working together and continuing to grow, we are ensuring Brockville General is right here with you.